I'm Dr. David Dobies, one of the cardiologists here at National Park Medical Center. The Heart Clinic is a clinic that's designed to treat heart failure patients and provide optimal medical therapy and recommendations regarding heart failure. Heart failure now has more treatment options than it had before, and it takes a team approach to coordinate the care to provide optimal outcomes. Heart failure is when actually the heart itself is not pumping blood the way it should, and it's a weak heart, typically called a weak heart. And heart disease is usually referred to coronary artery disease or blocked arteries, which are more symptoms of angina than having a failing heart. Well, it's per the guidelines now that you should have shared decision-making with patients and have a dedicated heart failure clinic, since there's many options available, and it's more of a specialty of cardiology than it was prior. Years ago, we had very little options we could give patients, so you didn't really need a specialized clinic. Now we have a lot of specialized medicines, procedures we can offer, and it's a more complex treatable problem than it has been previously. The goal of the clinic is to have patients have less chance of being readmitted to the hospital and to have less symptoms of heart failure. If you've been diagnosed with heart failure, certainly you should call the clinic, because it's important to find out the severity, the cause of heart failure. It could range from diseases like amyloidosis, which are rare but certainly treatable nowadays, which were not treatable prior, and also valve disease can be part of it. So there's a really of a comprehensive evaluation that should be done, and then treatments, and then to follow up with blood tests called BNP that can really see how well you're doing, and also should be optimized for better outcomes.